Hi, I'm Hodge. I'm an infectious disease specialist, and I've been doing this for more than 20 years. I'm currently at the Washington Health Institute in Washington, D.C., but at the moment, I'm here to do a video on Ask Me Anything about CABENUVA. Let's do it.
CABENUVA is for virologically suppressed adults and adolescents with HIV-1 who meet certain requirements. See full indication on screen. It is contraindicated in patients with a previous hypersensitivity reaction to cabotegravir or rilpivirine and in patients receiving the medications listed here. Please watch the entire video for additional important safety information. Please click the link to view the prescribing information for CABENUVA.
Well, thank you for joining us, and let's get into the first question. What non-clinical factors help shape your conversation with an appropriate patient about CABENUVA? Shared decision-making is central to the conversation. We must hear that patient's voice. I want patients to know that they're active participants in treatment decisions and to feel informed and supported when we talk about their options. It really depends on what they want and how it fits into their lifestyle, which is why I make sure to offer and discuss CABENUVA as a treatment option with all appropriate virologically suppressed patients. For me, it's very important that I present the options to my patients on a regular interval, making sure that their treatment goals are aligned with their priorities. All right, let's move on to the next question. Let's see. How do you determine treatment goals with your patients? Well, for a long time, virologic suppression was the only treatment goal that we focused on for people living with HIV. But what about next steps? Early switch patients are those who have recently achieved virologic suppression and may be exploring treatment options that better fit into their lifestyle. Established switch patients have maintained virologic suppression for many years on short-acting oral ART with no history of treatment failure and may now be considering options as their health needs or preferences change. For me, it's very important that I am proactive about presenting treatment options to my patients. Let's move on to that final question. What advice would you give to HCPs who may be uncertain about which patients to consider for CABENUVA? They look at me and they go, okay, we talked about CABENUVA in 2021 when CABENUVA came out. I always remind them that, hey, things change over time. This is where I remind my colleagues, you might want to ask something about patients' lives as they come in. It's important that you actually look at the preferences for the patient. Life circumstances could change those preferences. Their dosing preference may also influence their treatment choice. Some may prefer a long-acting injectable like CABENUVA. Thank you for joining me in this conversation. I would encourage you to look at some of the other Ask Me Anything about CABENUVA videos.
Warnings and precautions. Hypersensitivity reactions. Serious or severe hypersensitivity reactions, including Stevens-Johnson syndrome, toxic epidermal necrolysis, and drug reaction with eosinophilia and systemic symptoms, or DRESS, have been reported with CABENUVA or its components. Some skin reactions were accompanied by symptoms such as fever. Other skin reactions were associated with organ dysfunctions. Oral lead-in may be administered prior to administration of CABENUVA to help identify patients who may be at risk for a hypersensitivity reaction. If a hypersensitivity reaction is suspected, CABENUVA should be discontinued immediately and the patient should be monitored. Post-injection reactions. In clinical trials, serious post-injection reactions, such as those shown here, were reported in less than 1% of subjects within minutes after the injection of rilpivirine. These events may have been a result of accidental IV administration and began to resolve within a few minutes after the injection. It is important to carefully follow the instructions for use and observe patients for approximately 10 minutes after the injection. If a post-injection reaction occurs, monitor and treat as clinically indicated. Hepatotoxicity. Hepatic adverse events have been reported in patients receiving cabotegravir or rilpivirine with or without pre-existing hepatic disease or identifiable risk factors. Patients with underlying liver disease prior to treatment may be at increased risk with CABENUVA. Hepatic monitoring is recommended and discontinue if hepatotoxicity is suspected. Depressive disorders. Depressive disorders have been reported with CABENUVA or the individual components. Promptly evaluate patients with depressive symptoms. Risk of adverse reactions or loss of virologic response due to drug interactions. Adverse reactions or loss of virologic response due to drug interactions with concomitant use of CABENUVA may occur. Use with caution in combination with drugs with a known risk of torsade de pointes. Long-acting properties and potential associated risks with CABENUVA. Residual cabotegravir and rilpivirine concentrations may remain in the systemic circulation for up to 12 months or longer. Non-adherence to injections could lead to loss of virologic response and development of resistance. It is important to initiate a fully suppressive regimen no later than 1 month after the final injection doses of CABENUVA when dosed once monthly, and no later than 2 months after the final injections of CABENUVA when dosed every 2 months. If virologic failure is suspected, switch the patient to an alternative regimen as soon as possible. Adverse reactions. The most common adverse drug reactions were injection site reactions, pyrexia, fatigue, headache, and those listed here. Drug interactions. For important drug interaction information, refer to the full prescribing information for CABENUVA, Vocabria for oral cabotegravir, and Adurant for oral rilpivirine. It is not recommended to co-administer CABENUVA with other antiretrovirals. Drugs that are strong inducers of UGT1A1 or UGT1A9 are expected to decrease the plasma concentrations of cabotegravir. Drugs that induce or inhibit CYP3A may affect the plasma concentrations of rilpivirine. Use in specific populations. Assess the potential risks of using CABENUVA during conception, pregnancy, and while breastfeeding. Please click the link to view the full prescribing information for CABENUVA.